we will be focusing on healthcare. And healthcare is an issue in every nation, I can say. The pandemic has really driven the healthcare activity to a great extent. In China, it is still moving. I just learned from my son that China, the Omicron has crossed the desired figures, and there are a lot of crises happening in China. India is better off than others, I should say. But anyway, that subject is with Dr. Shah. I will just introduce Dr. Shah. I have already given his biodata for your reference to everyone. But Dr. Sameerkumar Shah is a consultant radiologist and founder of Canpic Medical and Education Foundation, Pune. His career interests are to promote affordability in healthcare through cost-cutting innovations, catalyzing by health, to start innovation clubs for affordability and innovation in healthcare, start a digital platform and global forum in healthcare with entrepreneurship and innovation in healthcare. Policy matters in healthcare domain with interacting with the World Bank, okay, you said USAID and Bill and Melinda Gates Foundation. So doctor is nowadays quite busy focusing on healthcare, rather affordable healthcare. He has got a long list of achievements which I have already shared with all of you. So without wasting much time, I will give the platform to Dr. Sameerkumar Shah to talk about healthcare and how it can be made affordable. So over to Dr. Sameerkumar Shah for his speech.
Namaskar, good morning, all of you. Dhanyavad. Many thanks, Vilasji, for the kind introduction. And I thank the organizing team of Tech Forum and all the members who are present here and for giving me this opportunity. And let us go to the presentation. Let me share my screen. I hope the screen is visible.
Yes, it is visible.
Yeah, fine.
It is visible.
Yeah. So today we'll be discussing about healthcare reform. This is one word, it's a buzzword, and it is essential in today's era, especially as Vilasji mentioned that we are going through a very different situation, a pandemic situation. And this is a non-traditional approach for offering solutions to the problems in healthcare domain. Now we will be discussing about a couple of policy matters wherein we are trying to see that health insurance sector comes as a catalyst for affordability in healthcare by any means. Secondly, we need integration of academics, research and healthcare services on a larger scale, especially in our country. And we'll be providing a couple of solutions to these issues in the form of a digital platform on a global scale, primarily to promote affordable innovations and a center of excellence for prevention of diseases, which will again focus on wellness and diagnostics. So we had some interactions with World Bank Group, Gates Foundation, USA India, Niti Aayog, which is a planning commission for our country, then National Authority, which runs a very ambitious health insurance scheme for the country, and Insurance Regulatory Authority and General Insurance Council. So again, what is a necessity today? Of course, everybody is talking about it, but there are very few organizations or countries which are really working on it in a way to achieve these goals. Now, the mission statement, even if you see with WHO, they would be talking about accessible, affordable, customized, evidence-based and quality healthcare services. Again, our organization is also focusing upon that. But we are trying to see that we focus on disease prevention, considering the local regional health problems. We promote affordable innovations in healthcare, thereby lowering the cost of services on one hand, and these innovations in the form of patented products should create wealth on the other hand. Now, this is the sentence of the whole presentation. This is a very essential sentence I'm uttering now, and I'm mentioning about these two activities are essential in this country at this point of time, at least. And again, as I mentioned, health insurance sector is to be involved, and we are trying to create awareness amongst the people. So what are the problem statements we are looking at today? What are the top priority areas in the form of problem statements? Rising cost of healthcare services is a major problem. Let it be India, let it be third world countries, let it be America or Europe. Cost is a major concern, even if it is for NHS, which is run by the government of UK, National Health Services. They're finding it difficult to cope up with the rising costs. And again, the wait list is very long. There are other problems which they are facing. With the pandemic situation added upon, things are worsening. So if you see, medical costs are rising up to 10% per annum, and 20% is the cost which increases for cancer treatment. So for a cancer treatment, the cost is double in 5 years. Now about 10 crore individuals are pushed below the poverty line due to the medical expenses. And it has been estimated by one organization in Maharashtra that 20%, 5% of the farmers used to commit suicide because of the medical expenses, and they were getting loans and other means of meet this kind of an expenditure on healthcare. Now, many countries spend less in terms of GDP allocation, and it has been an age-old demand since last 70 years in our country also to increase the GDP. Of course, with the pandemic coming in, GDP allocation has been increased, but again, we have to see that it is further increased. And 70% of the people spend out of the pocket. There is a huge growing burden of the healthcare costs. And again, there are certain solutions offered by the healthcare providers in the form of rigorous financial management, efficient operational performance, and outcome-based care, and innovative solutions. But again, they have limitations, and we are not able to see the impact in a significant way. And as far as charitable organizations go, 1% of the population in our country is supported through charity, in spite of having thousands and lakhs of non-profit organizations. So again, we can see that the problem, the burden is huge. And again, health insurance penetration is poor, in spite of opening up the economies over last 30 years. And the capping for the investment is again, we have raised the bar, in spite of which health insurance penetration is not really up to the mark. Now, we'll go and look at the medical device segment also. A WHO report says that most of the devices which are used in developing countries are designed for the use in developed countries. They are either unaffordable or they cannot be adapted in this kind of a setup. And 80% of the medical devices we are importing. And there is a huge gap between the demand and supply. Kind of oligopoly situation is there. And market is dominated by America and Europe, which cater to about 75%. China caters about 18%, and we have yet to reach a figure of 1%. This is on one part. On the other hand, if you look at radiological medical devices like X-ray and sonography, 70%, 5% of the population has no access to any diagnostic imaging. If you go to certain sub-Saharan African countries, what they have never seen an X-ray or a sonography machine. So these are the problems. Now, why this is these problems are there, especially medical device sector. It's a $400 billion global industry. Indian medical device industry is about $3.5 billion, but that is a market which the exporters look at India as, and we have less than 5% of the contribution in the $100 billion sector. So again, there is low indigenous manufacturing, unmet funding requirements, conducive environment. These are all some of the problems, and the ecosystem needs to be upgraded and evolved in this domain. Now, what are affordable innovations? These are the innovations which are need driven, and they meet the needs in resource poor settings. They do not compromise on the quality, and they are essentially wealth creating, accessible, and affordable. Now, who are the stakeholders we are trying to involve, and who should get involved rather? We have investors, corporates, medical device manufacturers, policymakers, government agencies, advocacy groups. Again, in non-profit domain, we have social entrepreneurs, we have venture philanthropies. Now, venture philanthropy is very rarely heard in this part of the world, as against in America and Europe. Of course, there is no reason to compare to our countries, but we have to be looking at these aspects wherein we are lacking at this point of time. And lastly, medical professionals, doctors in our country are focusing primarily on healthcare services, and of course that is their mandate. Our system has been traditionally geared for that. So providing services is a dominant activity. Medical education is a parallel activity to some extent in government and private sector. And our intention is to see that medical professionals and other allied health workers also get involved in to promote affordable innovations in a on a larger scale, and they have to be looking at it as a career option. Now, what are the solutions we are offering? As I discussed, that we are trying to come up with a digital platform on a global scale. It will be truly working on a global scale. We are trying to involve all kinds of stakeholders in that, from private, public, all the sectors. There would be an idea challenge program. Now, this is a kind of a challenges repository. We would be coming up, uh, listing the health challenges, problem areas from different parts of the world, different segments. Let's say health insurance sectors is facing a problem in certain areas like cancer treatment. The cost is very high. So they can list their problem statements, and we would invite solutions from the stakeholders from world over. And I believe that we have a vast talent pool in this country. We are a nation of 140 crore people, and our talented innovators, entrepreneurs at times have to go to America and European countries and innovate there. Again, the cost goes very high. Cost of innovation, cost of manufacturing is very high, and those devices are imported. We lose foreign exchange, and again, it's a vicious cycle wherein again the healthcare becomes expensive in our country. So it's a vicious cycle which we are trying to break. So Idea Challenge program, why we are trying to reach out to the different countries as well, sounds little ambitious, but it is a necessity because that is an opportunity for our innovators and entrepreneurs. So again, it's a solution, something like a lock and key theory, where we can provide a key to the locks, the challenges, to the problems. Now, another ambitious activity is to start innovation clubs. It's a kind of a monthly meeting activity in almost all the health establishments, in hospitals, in medical colleges, and other even polyclinics. Why not? I mean, we have most of the innovations coming from the people who are working at grassroots level. They face the problems day in and out, and they could be better innovators than anybody sitting in AC offices in government offices or anywhere else. So innovation club would not have any investment or cost involved on the part of the health establishments, and all the innovators could come, and allied branches like engineering, physics, biophysics, all those domain experts could come together, and they can take the activities, projects, ideas onto a next level. Secondly, if they do not find a solution locally, they can submit the idea on this particular global forum, wherein they will definitely get some kind of a support from world over. And again, health insurance sector is a partner. So this is the model how it will work. In public support, let's say any idea which is at a project at a conceptual level, we have a innovation ecosystem in place. In our country, traditionally, government funding is primarily seek upon, and then parallelly, we need to have non-profit, other sectors, venture philanthropists. Of course, VC and private funding comes at a later stage in a way. So we have to have kind of an alternative support system and models for the innovators and entrepreneurs. Now, let's say a project which may not have a successful business outcome to begin with, and it needs to be sustained at that point of time. Venture philanthropists or a non-profit organization could be supporting, and this is happening. This is nothing new I'm discussing. This is happening in America and European countries already. So this approach is necessary because we can attain health outcome as well as financial goals, and we get support from high risk R&D projects. Of course, any R&D project has inherently high risk. In our country, with best of the programs coming from government side, they are offering loans for MSMEs. As against loans, we need grants in larger terms. And so those needs could be sufficed with this approach. And high risk investments by a corporate sector could be avoided at an early stage, and other players, as I mentioned, non-profit and other sectors could play a role. And it's a win-win situation. A mandate for a non-profit sector is seeking that it benefits a large segment of society, so social outcomes. So in those terms, it creates a win-win situation. And this is why we are trying to promote this model. Now, just to mention about the Idea Challenge programs, Ebola virus is a major problem in Central Africa, but of course, it is not a problem in India, but we can provide a solution. There is a vaccine, but there is no treatment. It leads to defects of brain in the babies, in the feti, and it's a major problem there. We have a rich tradition of Ayurveda in our country. We can evolve a phytochemical for this particular problem, and maybe at least to begin with, that could be a solution, and maybe we can develop a molecule from that. And again, that is a necessity. I feel that there is a lot being discussed about Ayurveda and its greatness. Of course, it's a great science, but having said that, we need to see that it is incorporated in day-to-day practice, and we involve them in practice protocols. We can develop molecules from these phytochemicals, and I feel that is a leap we have to take at this stage, rather than just being a low-cost manufacturing hub for pharma. I mean, we are considered to be pharma manufacturing hub of the world. But having said that, we have to, little diversify and enter the molecular development segment also, drug development segment on a larger scale. Now, Innovation Club, as I said, that this would be there in all the. Now, again, this particular policy, now this, if you take any university in America there, and let's say Harvard University, they have been generating about, they have generated about $350 billion since inception of not only in healthcare, but other domains also. And we have service, academics and research as three dominant activities here, but they are all discrete, especially in our country. There is a integration. So similarly, we are trying to follow this model wherein the infrastructure which is used to provide services could also be used for R&D purpose. Human resources could be utilized for the other purposes, for academics or for innovation. And it's a kind of a activity which results in wealth creation. And when we are promoting affordable cost-cutting innovations, it will result in cost stabilization. And we can attempt or evolve a model of cross-subsidization. It's an alternative financial model for sustainable activities in healthcare service domain as well as in medical education domain. We have been observing that medical education is becoming very expensive, and for a graduation, private medical colleges, one has to spend around 1 crore rupees for the entire course. And again, there are gaps in the educational career domain, career span to study for the entrance exams. They have to go for post graduation, super specialization. So all this leads to a huge economic burden on the medical student. So again, it becomes a kind of an investment and recovery model. Of course, in any domain it is happening, but again, here it becomes a kind of a situation wherein they have to go for early recovery of the investment. Of course, that kind of a situation is there currently. Now, what are the benefits to some of the other public healthcare programs like Ayushman Bharat? It's a public health insurance scheme, very ambitious, one of the largest in the world. And we have Medicare and Medicaid schemes also run by the American government. And so various states are also running certain schemes. Now, what is the benefit of this particular policy of integration? So wealth creation, cross-subsidization would be there, sustainability could be both, because somewhere we have to cut down the cost so that the premiums could come down. I hope my screen is visible.
Yes, screen is visible completely.
Yeah, so that is very important. We can assure the sustainability of an ambitious scheme like Ayushman Bharat scheme, wherein, and in fact, we had a detailed interaction, a few meetings with their team, and they've asked us to have a separate section for attaining their goals, which are there at this point of time. Now, another solution we're offering in the form of a Center of Excellence for Wellness and Diagnostics, wherein we are trying to provide clinical outpatient services in terms of diagnostics or OPD services, as I said. Then, but apart from that, we will be considering the local regional health issues. We would not just practice the, medicine based on the research papers or other activities, academic, papers published in different parts of the world. We need to modify them considering the local regional factors, socioeconomic factors in our country. And there are knowledge gaps in the clinical practice protocols, and we are trying to bridge them up. And we have to create awareness amongst the medical fraternity and the patients. So there would also be novel applications of existing diagnostic modalities, which would be aiming at significant treatment cost reduction. So innovation to promote medical devices, technical other technologies, mobile-based applications, and here it is a service-based, kind of a innovation protocol which we will be promoting. Secondly, we can also promote our traditional medical science, and we would like to disseminate these protocols. So this is a kind of a picture which shows this is a knowledge gap in which we will try to bridge. And I'll give an example of that. Uncontrolled diabetes. Of course, there are many more such problems which we would be addressing, and we would be inviting these problems and solutions even at this center. So uncontrolled diabetes is a major problem, and those patients who are taking insulin, they have their fat below, which is below the skin, which gets damaged, and it is known as lipodystrophy. And because of uncontrolled diabetes, patient would lead to it leads to heart disease. Patient may get heart attacks. Patient may get paralysis. Patient may get renal failure. Patient may require dialysis, and the cost is increased at least 5 to 6 folds. And it has been studied in various parts of the world. So $1 spent out of every $4 in America is spent on diabetes. They spend around $350 billion annually. So in our country also, we have about 1 to 1.5 crore individuals who are on insulin treatment, and they may have this problem of lipodystrophy. So this is a normal sonography image. This is an abnormal image. We can identify normal abnormal areas, and we can inject in normal areas and what we call sonography mapping. And this particular sonography protocol for 2 or 3 times in a year may save around $3 to $4 billion, around 30,000 crores in rupees in India annually, because the cost of insulin increases because they have to increase the dose, they have to go on to a higher cost increase in insulin like human insulin, and these are the problems, and yet the diabetes is not controlled. So a patient who is receiving a secondary care is pushed onto a tertiary care or with complications, so which we can avoid. And this is a very good example of secondary prevention or tertiary prevention in a way. So this is these kind of protocols which we will identify and we would like to promote through this center. Now, what is the role of health insurance sector? Why we are so keen on involving health insurance sector? High claim cost results in high premium. And again, high claim cost is there because of high cost of treatment. It's directly proportional to the treatment cost. So we are expecting that through affordable innovations, treatment costs will go down, and it will benefit the sector with business growth as the premium would also go down. They can directly provide support to such activities, what we have been trying to do. Thirdly, they can directly involve doctors and provide some incentives for cost-cutting activities or services. So it is a kind of a market force which would oppose the other market forces which are trying to increase the cost. Of course, there are other reasons involved, including malpractices, but market force will definitely take care of a market force. It will rather counter a market force. So that is the reason we are trying to involve this sector. And again, about $3 trillion are spent. Of course, today's figures are again increasing. So in America, let's say we save around 1% of that in coming few years, then we can save around $30 billion annually. And there is an example. This is not just a theoretical activity. Some people are practically doing it. There is a company very much in Pune, which is promoting these FDA approved products. And I think he has delivered a talk on this forum also. And the cost cutting is by 20%. Their market share is 2% today. And they are saving around $16 million annually in America. If their market share grows to 20%, they can save around $160 million. And this is an example of a low-cost manufacturing, which is innovation-based, again with FDA approved, patented products by company in India, endorsing upon significant economic impact globally, creating a win-win situation for the service providers in healthcare, patients, health insurance companies in America, and the medical device company in our country. So this is a kind of a situation we are envisioning, and we can replicate this with 10, 50, 100 more companies. The impact would be in billions of dollars. It's just that these companies, I really appreciate a company this company which is based in Pune, that they are putting individual efforts at their level and trying to make an impact out there. And If it is organized effort, I feel that the impact would be significant. Just to compare the cost of certain treatment in America and India, it's almost tenfold of the cost. And these are the reasons why the cost is increasing. Again, there is a problem in America. They are trying to go for pharma price capping because COVID has been hitting with each wave. It is there is a burden on the government, and they are trying to uh, go for pharma price capping, as I said. But again, that would be really, retaliated by the uh, lobbies there, and they require around $3 trillion. Additionally, if the government wants to support the insurance program entirely, and people are losing jobs. I'll just show you in this picture, but 60% insurance comes from the employer in America. And with the COVID pandemic situation, people lost their jobs, and that uh, burden was on the government to support them for in the form of premium costs and everything. And they have a hospital insurance trust fund, which is, in the interest of that, they run it. And again, there are limitations to this fund, and they increased premium costs and dependence on increased government funding will continue hereafter, and that is creating vulnerabilities for this fund. So this is the situation. So a middle solution for this is to go for affordability through cost-cutting innovations, and it can definitely result in healthcare making it affordable. It could generate some revenue also, especially for the public sector health institutions like All India Institute of Medical Sciences in Delhi gets a grant of around 1,000 crore rupees a year. They may create some wealth and become self-reliant in coming few years. So this is the new equation we are trying to set. Of course, at a local level or on a global scale, it works very well. Lobbying is legal in America. You can just to mention the kind of uh, amount spent on lobbying, $300 million US, as against health insurance spending, sector spending around $12 million US annually. Just to summarize, affordable innovation is a great necessity. We need a kind of a global forum, digital platform to aggregate all the stakeholders. Thirdly, health insurance sector would act as a major catalyst, and that is the market force. We need a chain of center of excellence for focusing on prevention so that it results in cost cutting, and it would result in a significant macroeconomic impact. And truly, we can promote Ayushman Bharat scheme, or we can truly promote Make in India. We can become a low-cost manufacturing hub if we can scale up these kind of activities and become self-reliant, as is the mantra today. And this is just to mention, we cannot solve a problem by plucking the leaves or cutting the branches or cutting the stem. We have to hit at the roots, and this is how we are trying to. It's an attempt to reach the root cause of the problem and give a solution at that level. And this is a non-traditional approach we are trying to look at. So it's just that I'm trying to connect with some of these companies. And again, I thank for all of you for gathering here on this Sunday morning, in spite of all the commitments. And I again thank the organizers, the entire team of Tech Forum, Vilasji, Chaitanyji, and everybody out there for inviting me and initiating such a wonderful forum. Yeah.
Thank you, Doctor, for wonderful presentation. You are really taken us and given a very good journey how the healthcare reforms can be done. And I assure you on behalf of Tech Forum, we are all with you, and we would like to support your endeavor in any way that you request. Definitely, it is a need of an hour for the nation, need of an hour for the people of the nation, and need for the healthcare industry also. Because of this pandemic impact on our economy, really prices have gone up and income has reduced drastically. So in this situation, healthcare is going to be a great challenge for the Indians. Unlike China, I think China today is facing crisis in healthcare because of the Omicron pandemic. The patients are in the verandas and parking lots, and still they are unable to do so, and they are having a very serious, rather horrible steps to control it. But anyway, now we will go for question and answer. Let's see. First, those who want to ask question, please identify yourself and shoot out your question. So over to question and answer session. Let someone break the ice.
Good morning, Doctor. Anil
Good morning.
Chaitanya here.
Yeah, Anilji, please go ahead.
Your innovation center concept is really need of nation. It's a need of India.
Yes,
And
yes. Thank you.
on this tech forum platform, we are there to support you.
Yeah,
This
thank
as
you.
well as your all other options. I
Yeah.
suggest here that we will create a special group under a tech forum to
Yeah,
support you.
sure.
That
Yes, thank you.
that under that group we will interact with industry. We will invite the industries on this group and explain need and their support, how they can do all these things. This is what I feel after hearing all your presentations and stories. As well, we can have a meeting with industries between medical industry, innovators. We can have an interactions. We can have a Zoom meetings, and we will collect recommendations from them, which we can be shared to the government. Here, I request you to take a leadership through Tech Forum, as you are the member of this Tech Forum platform. And I
Yeah, sure.
also request Mr. Gautam More to contribute in this front.
Thank you.
So this is what is my principal
Yeah,
suggestion.
one of our EC member Gautam More is with us today. So let's hear from Gautam his comments and how the electronic industry in medical electronics can support this. Over to Gautam.
Yeah, good morning, Dr. Shah.
Good morning, Gautamji.
Yeah,
Yeah.
you had a great presentation. I think you, with most other people working in healthcare, have now realized, the problems you've listed out. And thankfully, I mean, this visibility of the problems itself was a big issue with all people trying to solve the crisis. I think more and more people like you are setting out the template that this is what needs to be done, and luckily the government also is kind of keen. Like you are setting up a holistic organization. I think that's the need of the hour, and it will be great to help you, proceed on these various fronts, because most of healthcare is like social enterprise. Working in healthcare, it can't be done with pure profit in mind. So I'm always
Right.
very appreciative of people going out, in full force to address issues and create the ecosystem required. So there are many healthcare companies in Pune also working on various aspects, and hopefully, one of the things that you mentioned correctly is having a grant ecosystem, local grant ecosystem, which I hope you can bring together. There are
Absolutely.
multiple people who have the correct ideas also and the correct capability also, but the engineering is always a cost, in the end, and that
Yeah.
cannot be an investment out of pocket, especially in healthcare, because you can't have anything done as a jugaad here.
Yeah.
So
Absolutely.
and grants are definitely the way. And see, the what I have seen is like the central government grants are distributed all around the country, so they become quite competitive. So it's a really big need to have localized grant ecosystem, which I think you are correctly set out to do.
Yeah, and our CSR could help at that level. And that is the reason we are trying to suggest to Niti Aayog. In fact, we had a couple of meetings again with member. And we are trying to say that you make innovation clubs mandatory, because people have to really be in a hospital and see, and the doctors also should get involved, so that, all those technical team, all the technical experts, engineering experts can come and innovate there. If the things are becoming so in silos and dichotomous, that each one is putting efforts in their own direction. So again, the
Right.
CSR could also come in, which is coming anyways for patient care. That could be utilized for innovation, which can take an organization to take a leap, and they can go on to a next level in a way. Yeah.
Yes. So these CSR were always keen in one way, but they were not finding correct platform, because they have to be accountable and liable to a lot of scrutiny otherwise. So I think somebody, the way you've set it out, hopefully it will give them that confidence that it will be, handled correctly, and all, it will become a simpler way for them to engage. Look, like in Pune itself, there are multiple pharma companies, manufacturing units, and they have absolutely healthy CSR budgets. But something like this, they try to do with the incubators, but I think that's not have been very successful. But I would also suggest that you take on maximum like-minded doctors on board, because that brings
Sure.
higher credibility than having engineers.
Absolutely. So basically, honestly, we are trying to make again another innovation club mandatory, and we are suggesting to Niti Aayog that even doctors, it should be made mandatory to join these this kind of a
Exactly.
platform, because unless and until it happens, we are exposed to the that segment. It's very difficult. Now, suppose there would be at least 5% doctors in an institution, let's say Ruby Hall Clinic, where I was a consultant, who want to innovate. So they
Correct.
don't have any avenues. They will talk to their HOD, to their professor, or to the dean at the
Right,
most, or
right.
director. And then, again, we are creating bottlenecks. It's not that, the world is a village today with the technology coming in. So there would be takers. If there would be NRI, let's say in Kenya, a diamond mine owner some would feel that I want to spend at least $5 million for a cancer. So something of that kind. So we have to bring in all these people. It would be very easy if these things are made mandatory. Of course, it's sounds very courageous to say that. Yeah.
Right. As a really tangible step, maybe one of your first innovation clubs should be targeted to be in BJ Medical College, so that it is.
There is a activity happening there, out there. In fact, they had invited me also for that particular purpose. But again, what happens? Suppose the projects which require some support, which are very nascent ideas, which require a lot of technology support and other things, we have everything here. But again, it has to be flanked by other domains also. We have to involve investors and other people who should be visiting, involved, there in a way. Yeah.
Right. A few students had started that innovation club 2-3 years ago. Now, no, not 2-3, maybe 5 years ago, and probably they have now passed out as well. So it all depends on. So there's always need for this outside agency to lead such things. To say that okay, we'll do the arrangement and licensing. You just get into the flow of providing support. So that's how I think it'll go. But yeah, excellent. I mean, the thoughts that are.
And lastly, we want health insurance sector. Let's say why we are trying to talk about America again and again. Of course, we have to focus on our problems in our country, because it's a very high cost model there. Any impact there, it is very significant, and we can trickle it down easily. So they can support. Let's say tomorrow, their CSR could be a huge, corpus fund for our innovators here in India. Let's say United Health Insurance Company has a turnover of $200 billion. Their CSR goes at least in a couple of $1 billion.
Correct.
Even 20-30% of that would be more than enough to begin with, and to provide these seed grants to the individuals here, because unfortunately government agencies indirectly act as bottlenecks. Huge demand supply gap. I mean, there are so many innovators, entrepreneurs, and again, of course, the success rate would be anything between 10% anywhere in the world. I mean, it's not that we would have it very poor or something here. Yeah. I
Good input.
Hello. Very nice discussions. Thanks, Gautam, for really valuable inputs and suggestions. Mr. Satish Mehta has raised his hands. So, Mr. Mehta, please introduce yourself. Please introduce yourself.
Yes, sir. Myself, Professor Satish Mehta. I am electronics and telecom engineer and working in engineering college, Army Institute of Technology. Are you able to hear, sir?
Yes,
go ahead.
Because I am in a workshop, so there is some noise here. I don't know. Sir, I have got the persistent problem. Now your healthcare and everything is very fine, but most of the at least 90% of the students at the college level, I'm saying, because your innovation is somebody becoming ready for innovation, educational level. So educational level, 95% people are going to software. So how will you attract the students to your medical field? Because it is not a very straightforward. First, suppose he does BSc, then MSc, PhD. It is a very long path. And I have seen my own son, really facing many problems in like personal level.
So, Satish ji, this is a very valid point you have raised, and I really thank you for raising this issue. Because
there are
yeah,
hardly any students. So what is the incentive by the government? So these sectors which are students are not ready to go, then government should provide some incentive for them that if you go to this course, that there are better scholarships, etc. Because like that, just like that, nobody is going to go other sectors than software. That is
absolutely
99% truth, sir.
Yeah.
100, now I will say 99.99% truth.
agree.
Yeah,
Very
let,
true. Absolutely.
let Dr. Shah give an answer. Yeah, he has
Yeah.
understood the question. Yeah.
Yeah. No, this is a very valid point you have raised. Now, what we have been you raised, in fact, you mentioned about incentive also. In fact, when we discussed with Niti Aayog about starting these innovation clubs, making them mandatory, we suggested the same thing, that they have to give a lot of tax incentives if the revenue is generated from R&D and innovation-based activities from any of the hospitals. So I agree, and your point is very, very well taken. Of course, these are the things which have to be done by the legislature at a from their side,
Yes.
and definitely we can give
One
this
more,
input
one
to
more,
them.
one more thing, sir. The engineering and medical combined course, if it is formed, then it will be just like there is a mechatronics. There should be something like biotronics or something like that, which is a honor course. That means 4-year normal course. In addition to that, 1 year, which is combined with biology.
Yeah.
I think
That
some
is
IIT
also,
have not done it, but it should be a normal and compulsory thing.
so
With
that is
incentive.
agree. Your point is again well taken. Problem is that I wanted to do biomedical engineering when I graduated at just in medicine, and I had been to IIT Bombay and all, wherein all the courses were available. Problem with biomedical engineering course today is that they have to join these medical device companies as what you call application specialist or something. Some of them are involved in marketing. Problem is that we have not created enough opportunities for these kind of courses, or because R&D as such, which is should be a major activity parallelly apart from service domain,
R&D
so
is zero, sir.
needs to
R&D
be
is zero. I'm sorry.
it needs to be verified. If you see, there are application specialists. If you see, 80% of the biomedical engineers are working in application specialists for some sonography company, X-ray company, and all those MRI, all those things in medical device sector. So there is the problem, and that is the reason we are trying to create this digital platform on a global scale, wherein we are trying to invite the challenges world over. These will create opportunities here, and then we can hope for these courses to really flourish and benefit the students and candidates who are. We have to create opportunities. If there is no opportunity, where they would go? Not everybody can go to America and Europe and settle there. And again, even if they do that, it is a vicious cycle we are creating, because the R&D inherently is very high cost there, and we import happily the high cost devices, and again our system gets overburdened. Let it be a public sector or whatever sector. So
Yes.
we have to break this vicious cycle. That is the reason we have again I'm showing this slide. Idea Challenge program is a very, very ambitious program again, and I'm mentioning, I've given this example. Central Africa, we are not even concerned. Nobody talks about Ebola virus in India because it's not a problem, but it's an opportunity. So once we enlist these problems through various countries, again, this like it is like creating a parallel WHO for innovations. But if it is so, we have to do that, and we are willing to do that. In fact, World Bank Group had assured us funding within the first meeting, considering the ambitious nature of the whole activity and the possible impact in future. But it was entirely a commercial kind of a funding they wanted to come in, and that is the reason we had to wait. Because of COVID, they had some issues with the global situation changing. Everybody is aware of that. And again, coming back to your point, Satishji, Idea Challenge program is the kind of a beginning for creating opportunities for these people, because it's a lock and we have to provide the keys, lock and key theory kind of a situation, that kind of activity.
So if anybody goes, if
hello,
anybody,
hello. I have something.
if anybody goes for biology course, what incentive he gets further doing MSc and PhD? That should be at attractive level by some government.
I agree. We need, again, apart from healthcare reforms, we need the educational reforms also in this country. With due respect to all the experts on policymakers sitting there at the top, and here, issue is that our courses are not industry oriented. We have same Bachelor of Arts, BCom and BSc systems running since 70 years. And again, how much they are industry oriented, again, people have to go for some other combination courses. So again, that increases the time. So parallelly, if something can be done, I think there is a good achievement, decision.
Yes.
I think 2 courses could be done simultaneously. But again, those courses have to be chosen or designed in such a way that they are industry oriented and they are job oriented, or at least for, in a way they get earliest they can get some jobs.
Yes.
Hello, I have
Good
something
input.
different to share about all these things.
Please.
If you allowed me, I can speak little different
Yeah,
things
please,
about that.
please.
Okay.
Please go ahead.
Okay, this is a matter of multidisciplinary skilling under various sectors, whatever we discuss. That is if we are engineer, he wants to work for medical sector, he needs some knowledge on medical. Or he is learn on medical, he needs some more knowledge in engineering sector. There is a separate ministrate level department in Government of India about Sector Skill Council under National Skill Development Council, and we are there already started working on this, and we have created BVOC courses for who is already educated or who wish to get more knowledge, practical knowledge in other multidisciplinary area. Because after Corona, within Corona, there are lot many changes in the requirement of skilling have been there, and these courses are funded by the government. For example, there are courses for manufacturing medical devices, BVOC courses. The method and technology and what care should be taken and all stuff will be trained to the medical educated people in India. It is certified by government and which is applicable all over the world, accepted very highly. And healthcare administrate has many much requirement receiving them for such type of courses. This is so I mean to say that Indian government is already identified this problem and started working in this. As Mr. Mehta said that he looks some financial support for learning all these things. Yes, there are schemes for the students as well as the companies who want to run the courses. And if you have any special course you want to define or design, statistical councils are open to accept and run the courses exclusively for medical devices or the medical purposes. This is what is the update I would like to share with you. And if you come up with actual requirement or the reformation in teaching or the skilling, this is a matter of skilling other than education. So if you come up with a specific need of skilling, we can have a word with statistical councils and introduce such courses. I have already designed BVOC courses for medical purposes. So I have an experience in this area, which is available on this forum for all of us, anybody who wants to contribute in a skilling and education purpose. Thank you. I'm over.
Thank you, Anil. Yeah, I think we have an industry representative. Let me see whether he is there. Mr. Girish Ranade from Futura. If you can comment from industry side, Girish,
Yes,
please.
sir. Yes, sir. Thank you. Sir, I don't have a question, but can I give some comments?
Yes, very much.
Yes, please go, sir.
Yes,
go ahead.
Good morning. And doctor, you are doing a wonderful job with this Canpic Medical and Educational Foundation. Thanks for this. Sorry, I joined a little late, but I could catch all the gist, whatever you were saying. And just to introduce in one sentence, my name is Girish Ranade, and I am running an industry or a small medium organization for last more than 30 years. We are not in medical electronics, but I am a designer by education, and I am also a student of late student Shekhar Kulkarni, who happens to be a staunch supporter of reverse engineering. Innovation, in a way, it is very good. There is no doubt about it. But the route may be a little bit longer, time taking, and it requires a lot of many skill sets to come together, including medicine and what we discussed just now. Another route which I would like to express here or mention here is reverse engineering. Now, for that, one small initiative, if your organization can take it up, that existing imports list if you can get with through your organization. Of course, it is available to everybody, but if you can gather that information, existing imports list of medical devices and with value wise, so that list will help, and a small document or presentation or some something on web, if you put that list, will give incentive to many people to look at least into the product, and the product can be reverse engineered. I have already done some reverse engineering, and I am of I mean, people think that reverse engineering is simpler and non-innovative. It is not at all so. It is equally innovative, and you need equal amount of technical expertise to make a product or to reverse engineer a product. There are a lot of advantages. I won't talk about it because reverse engineering is already discussed quite a lot. So we can also look into imports in India as well as imports in other countries like African countries, and those can be made here. That is what is my small comment, and thanks for giving me this opportunity. Thanks.
Very valid suggestion, and I really respect your approach, and that's how China has grown to the size of 18% as market share as far as medical devices go. So reverse engineering is a dominant activity there in a way. So definitely, and with your inputs are well taken, we'll definitely try to work on it.
Yeah, good inputs and good interaction. Girish, thank you very much. Do we have any more questions from the new one? Let's give opportunity to others. Ashok Dingra, would you like to comment, say something? Okay, he's not there. Okay, I think most of the people have interacted, and it was a nice interactive session for more than 30-35 minutes. So which shows the importance of topic. Yeah, which shows the importance of the topic. And really, Doctor, you have done a wonderful presentation today. Tech Forum is with you. Definitely,